Welcome to Sisters Inc., our podcast for and about women business owners, brought to you by Black Enterprise. I'm your host, Elisa Gums. Black women are the fastest growing group of entrepreneurs in America. And on every episode of Sisters Inc., we'll sit down with one successful CEO and share how she slays the challenges of being a Black woman in business. Today's episode is all about identifying a gap. We're chatting with Dr. Iman Abuzaid, the CEO and co-founder of Incredible Health, a digital career platform for healthcare professionals. Founded in 2017, its custom matching technology is now used by more than 500 hospitals nationwide to hire nurses in less than a quarter of the time it usually takes. Welcome to Sisters Inc., Iman, and thanks so much for sitting down with us.
Thank you so much for having me.
Your family is filled with doctors and also entrepreneurs, so it seems only natural that you've taken this path. But tell us how you came to have a passion for the medical profession and the desire to be your own boss.
Got it. Yeah. So my father's a surgeon, and so are my two older brothers, and so I've just, I guess, been exposed to healthcare from an early age. And then, in addition to that, both my grandfathers were entrepreneurs. So I am originally from Sudan. I grew up in different countries around the world, and I did end up going to medical school. And after medical school, decided to go into management consulting next, doing hospital operations and strategy. Then did my MBA, then moved out to the Bay Area to really get into startups and entrepreneurship. I think the common theme through all of that is, first, I think working as a clinician is great, and one-on-one patient care is amazing, and that's a great career. But I really wanted to have an impact on a larger scale, and that is why I ultimately ended up pursuing entrepreneurship, because with companies and products like Incredible Health, you can have an impact on so many different healthcare workers and an entire health system too.
So you just mentioned that you worked previously in medical consulting and also for healthcare startups. What did you take away from those experiences?
Yeah, I think my first experience after finishing medical school was at Booz Allen and at McKinsey doing management consulting with hospital operations and strategy. I mean, this is it's like my first job out of medical school, and it was there that I really got exposed to the U.S. healthcare system, the different challenges that it has around cost and access and quality. Those are the three things that every health system is trying to maintain. I also just, developed some core skills, right? Presentation skills, analytical skills, communication skills, just like, many, many early jobs that are right out of school. During my time in business school, I did my MBA at Wharton. That's really when I got even more exposed to entrepreneurs, because many of my classmates were entrepreneurs as well. And that's, I really started to get an appreciation for what software can do to make a huge impact. And I decided then to move to the Bay Area because the San Francisco Bay Area is the capital of tech. At least it was at the time. I don't know if it is right now. And really joined an early stage healthcare technology startup. And I joined as a product manager. And that's really where I learned to work with software engineers and designers and data scientists, and what it takes to really build a software product that's useful, that has a high ROI or a strong business case, and what it takes to grow a product and a company as well. And so after doing that for a couple of years, then decided to start Incredible Health. So there was definitely quite a lot of skill building and networking and so on throughout those experiences.
And a lot of exposure to the healthcare sector through those experiences. What did you find was lacking in the marketplace?
So, the US healthcare system, like many other healthcare systems, frankly, has many challenges, right? It has challenges with trying to keep costs down. It has challenges with trying to increase access to care. It has challenges with trying to maintain the quality of the care. And so I get really excited when entrepreneurs try to pursue some of these challenges. I mean, for me specifically, and this sort of, this is why we started Incredible Health, is a lot of my family members and friends are doctors and surgeons, and they actively practicing here in the US, and they were often complaining about understaffing. And then at the same time, my co-founder, Rome Portlock, is a software engineer, and he has several family members that are nurses. And they were saying, I'm experienced and I'm qualified, and I apply to 10, 15 places, and I often don't even hear back. And we're like, okay, this is really strange. We know that healthcare is the biggest labor sector in the country by number of workers. We also know that it is an industry that has severe shortages of workers. We are on track to be 1 million nurses short by 2023, as an example. And our demand for healthcare as a country keeps going up. As our population ages, of course, like pandemics don't help, and the supply of workers has not kept up with the demand. So we figured there just has to be a better way. Once we dug in more into it, we discovered that the processes, the technology, even the strategy that hospitals and health systems were using to hire nurses in permanent roles, and other professions as well, just really hasn't changed since the early 2000s. And it requires a very different approach, a much more nurse-centric or talent-centric approach to win in a highly competitive market like this.
So when you and your co-founder were first sitting down, like what was it that you were setting out to do as you were crafting your mission?
Yeah, I mean, we wanted to just solve the underlying problem at the end of the day. And that's the immense amount of inefficiency between the supply and the demand in this market, the employers and the talent. And then ultimately, over the course of 10 years, we wanted to solve the underlying supply shortage too. So we developed this vision, of helping healthcare professionals live better lives. And the mission is to help them find and do their best work. And what we've created is Incredible Health, which today is a career marketplace technology. And hospitals and health systems use our software to hire nurses in permanent roles in 20 days or less. There's 3 unique things about our product that we've developed. First, the employers apply to the talent instead of the other way around. The second is we've automated the screening of the talent, so we're able to serve up high quality supply or talent at all times and at scale. And then the third is our custom matching algorithm. So it's a highly personalized experience for both sides of our marketplace. And the end result of that is hiring that happens in 20 days or less instead of the national average of 90 days. And then we also save each location that we work with at least $2 million in travel nurse costs and overtime costs and HR costs per year. Today, fast forward, we've been building this for just around 5 years now. We work with 500 hospitals and health systems across the country, including really big ones like Kaiser Permanente and Baylor Scott and White and HCA, and lots of academic medical centers like Johns Hopkins and Stanford and Cedars-Sinai, and many community hospitals as well.
Can you talk to me some more about the way the platform is set up? Because you just mentioned that there's like 3 things that are unique. And the first thing, I really caught my ear because that's such an innovation that the hospitals apply to the nurses as opposed to the other way around. Like, how did that come to be?
Yeah, that innovation and that concept came to be in a couple of different ways. First, we really got a strong understanding of the market and understood that the demand dramatically outweighs the supply. So there's a lot more demand from employers than there is talent. And so from that, that means we can build a model where the demand is applying to the supply instead of the other way around. And it would work favorably because of that supply demand imbalance. And then the second thing is, like, we looked at other industries too. There were other companies, primarily in software and in tech, that were doing a similar model for software engineers, which is another area of huge supply shortage in this country. And so, it's almost like you got to connect the dots when you're an entrepreneur and a founder between market, other ideas, what other teams are doing, what other industries are doing, and in order to develop like your key insights as a founder.
And I would imagine that you would have no trouble attracting nurses to your platform once they know that they're the ones that are sort of, in control.
That's right. Yeah, it's giving them a stronger sense of empowerment and more control has been really helpful. And that messaging of employers applying to the talent is very helpful. And now for the nurses specifically, their normal job search experience is I applied to 10, 15 places and I didn't even hear back, right? And it's like a black hole. And even when I do hear back, it still takes so long. So even despite the supply and demand imbalance, nurses were just not getting through, especially for permanent roles. So that was definitely a key insight. Now, the other thing is, like, we've really expanded this to make sure that Incredible Health is not only the place where a nurse and eventually other healthcare workers find their job. It needs to be the place where they manage their career. So today we also offer, other tools and services completely for free to nurses too. So for example, free continuing education for every single nurse in the country, which they need to renew and activate their licenses. And so they never have to pay out of pocket for continuing education. We have free salary estimators. We have an advice platform for nurses built into our apps as well. And every single service from the hiring marketplace all the way to the continuing education and the advice platform is 100% free for the healthcare workers and for the nurses. And so it's important to us that nurses are using us throughout their career and even in between jobs, instead of just having a one and done transactional relationship with us for getting a job.
You mentioned that, of course, the pandemic is only making the nursing shortage worse. And so understandably, business has been booming for you during these times. How, as the CEO, have you managed that growth?
Yeah. So this problem definitely existed before the pandemic, and you're right, the pandemic did exacerbate it. And all the projections we see that even in a post-pandemic world, the supply-demand shortage the imbalance and the shortage of talent will continue, simply because there's demographic changes happening in this country around our population getting older. Can you repeat your question again? I'm sorry.
Oh, sure, no problem. That the Incredible Health as a company has been
managing the
growing.
Growth. Yeah.
Yes.
Yep. So yeah, we've grown, our top line revenue like 1,000% since we raised our last round of financing in 2019. So in 2021 alone, we grew 400%. And you're right, that is quite a lot of growth to manage. We've also increased our headcount. Beginning of 2021, we were 25 people. We're now, 12 months later, we're over 100 people, and that continues to grow. I think there's several, I guess, tactics and strategies we had to put into place to manage that growth. First and foremost, I had to really spend a lot more time on maintaining Incredible Health's culture. And so we have a set of values that we implement and that we follow that helps us, the values that helps us operate as a business. The values are the operating system of the business. They're how we work together. They're how we make decisions. I'll mention a couple of them. One of them is customer obsession. Do whatever you can to delight users. Another one is speed. Move as quickly as humanly possible, because that's a top competitive advantage you have as a high growth startup. Another one is disagree and commit. We have to make sure it's a safe environment where anyone can dissent and speak up in order to address, make the best decisions for the business and for the users. We try not to make decisions here based on ego and title and who spoke the loudest. So first is culture. The second is like making sure we're hiring the right people. Definitely have a strong preference for those that come from startup backgrounds, because they have a strong sense of ownership. Also, for our senior leaders, definitely have a requirement that they come from a high growth background, because running a business like this that's growing this fast is not for the faint of heart, and it's not that easy. And then the third piece is we really have to work more on communication, internal communication, especially as we move to a remote first setting. We had to increase the frequency of our all hands. We had to increase our documentation. We had to increase the frequency of updates that are asynchronous, like through Slack or through email, and ensured that we weren't doing like meeting overload either. So just ensuring that we have really strong communication patterns and skills at the company has also been critical to managing that growth.
I have to say, you said it so matter of fact. So you're like, yes, last year our revenue grew 400%, as if that is not like an astronomical figure. And just clearly you are in the right position to run it, because you were cool as a cucumber when you said it. But I think the fact that speed is one of your values as a company has probably, helped that you planned for this.
Yeah, absolutely. The speed value definitely helps. Another value that really helps is delivering results. This is a pretty data-driven culture, and things get measured. We do look at inputs and outputs, so that's been really helpful. And then we have another value of hiring and developing the best. I mean, it's hard, but we do have to make sure that everyone we hire is as good, if not better, than who's already here. And that does put, the pressure and the strain on our hiring managers, but it's critical that we continue to do that.
So staffing is not the only gap that you're solving for. There's also the patient care gap, where people who look like us don't always get the care that we need, that we deserve, or that everyone else is getting. As a healthcare insider, can you paint the picture for us about what we're dealing with when we talk about institutional racism in healthcare?
Yeah, absolutely. So the problem of the sort of inconsistent or lack of diversity in among healthcare workers specifically is a problem that's been documented. It's been researched. There's tons of academic papers on it as well. Essentially, the problem is that the healthcare workers are serving a very diverse patient group of patients, and it's important that the healthcare workers, their demographics, their backgrounds reflect the patient population. When that does not happen, what occurs is that the patients report receiving lower care, lower quality of care. And that's also just evident in the healthcare outcomes of diverse patient populations too. When you correct for, even when you maintain like the location, the insurance status, the income status, et cetera, of the patients, minority patients in this country get worse care and they get worse outcomes. And it's across all disease areas, heart disease, cancer, kidney disease, et cetera. And that's just the reality. That's an uncomfortable reality that we're all dealing with. And so one of the key ways to counter sort of the lower quality of care that minority patients get in this country is to make sure that your healthcare workforce reflects the patient population as well. That tends to improve outcomes as well. Now, most of the healthcare industry is behind on making sure that our healthcare workers are diverse. I would say for nurses specifically, about 20% are identify themselves as minorities, but we do need to keep increasing that number. In addition, we're very behind when it comes to healthcare leaders. So those that are running departments, running units, running hospitals and health systems, both at the manager, director, and executive level. We are behind there as well. And so thankfully, there's a lot more attention on this topic now. And there are many DE&I initiatives that many health systems are putting in place to address the problem. At the end of the day, the problem has a direct impact. The problem of a lack of diversity among the healthcare workforce has a direct impact on quality of care.
And you believe that technology, healthcare technology specifically, can be a part of the solution?
That's right. I think technology plays a critical role and can be part of the solution. And I'll name a couple of examples. Technology can be used to correct human bias. So for example, we noticed on the Incredible Health platform and our hiring marketplace specifically, that when we removed the current location of the nurses, that tended to remove recruiter bias. Because what we noticed is that recruiters were biasing against talent that was living further away, even though they had a desire to live and work in the location of that hospital. And so when we removed the current location of the nurse, that corrected that human bias. Another example is we now use avatars for the profile photos of the nurses on our platform. Again, that corrected bias because when we were using real human profile photos, we did detect bias. And so the reason, the great thing about technology is you have access to quite a lot of data, and you can access and you can see how users are operating inside your platform at scale. And so you can detect these challenges early, and then you can actually do something about it. I think there's more that we need to do, and that we all need to do it as technology providers. I think there's quite a lot more tracking that we can do. For example, we should do a better job of tracking the demographics of the different nurse profiles on our platform, and sharing that data with the health systems. And then there's just more solutions that we can put in place to correct bias as well. So it's a continuous thing. It's not like a one and done set of activities, but it's something that we need to continue to strive for.
You mentioned that a lot of the hospital and healthcare systems you work with have DE&I efforts in place, and that your platform can correct for bias. Are there other ways that Incredible Health supports diversity efforts at their clients, or for the workforce itself? Because one of the things that I thought of when you mentioned that you are empowering the nurses to take charge of their career, and you give them ways to uh, do continuing education, ways to assess whether their salaries are fair. Here in New York, we happen to have so many Black nurses. And so I think of, empowering the Black women in those professions individually to be able to do something for this. So, I'll just let you expound on the ways that you guys support the diversity efforts.
Yeah, absolutely. So there's additional things that we're doing to support the diversity efforts. For example, every single nurse on our platform who's going through a hiring process gets customized like interview preparation, and that tends to help. Those that go through our interview preparation are more likely to get hired as well. We also have a whole range of career resources available through our blog as well, and in our apps itself, that can support nurses of all backgrounds, including those that are diverse. And then we also have an advice platform built into our apps as well, where nurses can give each other highly personalized advice. And I've seen this question multiple times come up, like, what should I be considering if I'm a minority nurse? How should I be presenting myself? Or what additional resources are there out there for minority nurses? And then the great thing is that we have, the other minority nurses in our database can respond with highly personalized advice as well. So there's certainly more coming, of course, but this is like our start in terms of just supporting this group of nurses.
When we talk about inequities, I spend so much time talking with Black women founders about capital and their fundraising or financing journeys, and about the inequities that exist there. Incredible Health has raised more than $17 million in venture capital. So can you share some of the secrets of your fundraising success?
Yeah, absolutely. I mean, I'll just be honest. Like the statistics are not very good for fundraising for Black female founders. I think it's 0.2% the last time I checked of venture capital that's going to Black female founders. I think that the top tactic I used, and the advice I give to all founders that look like me, is to suppress and compartmentalize that. It's good to be aware of it. It's good to acknowledge it, but it doesn't actually help you be successful in fundraising. And ultimately, what I've had to do is just really focus on being assertive and being clear about our vision and our mission and our traction, our product, and what it is that we're trying to achieve here, and the role that the investors can play in that. At the end of the day, you don't like, I cannot obsess or spend any time on on the bias that exists or on the statistics. And you just got to go in there and do your best.
You got to do what you got to do, right?
Exactly. You just got to go win.
You just got to go win. I love that. Thank you so much, Iman, for sharing your small business success story. Everyone out there, please take a look at the company website, incrediblehealth.com. You can also follow them on Facebook at Incredible Health Jobs, on Twitter at Join Incredible, and on Instagram at Incredible Health. Check out the podcast channel on blackenterprise.com to find Sisters Inc. and other podcasts from Black Enterprise editors, writers, and experts. Be sure to subscribe to Sisters Inc. on Apple Podcasts, Spotify, SoundCloud, and YouTube. And if you like what you hear, please show us some love by leaving a 5-star review, or put a sister on by spreading the word. This is Elisa Gums with Sisters Inc. for Black Enterprise. Thank you for listening.